Hey, welcome to the Go To Physio Lumbar series. Now, at the Go To Physio and at the Go To Physio Mentorship, I teach how to look at the lumbar spine a little bit different to how I was taught in university. So a lot of people, when they go to touch their toes, okay, let's say for instance, you're going to touch your toes and you've got back pain, a lot of persistent pain patients. What I would look at here is we would almost break the body down into these different segments, okay? So again, we would say to the patient, just like the other series we've done, okay, you need to do 25% at your low back, you need 25% at your rib cage and torso, you need 25% on the legs, and let's just keep it very, very simple, okay? Now, one of the big things that we focus on here with the lumbar spine, okay, is the ability of the rib cage to depress and retract. So as we go to touch our toes, one of the first tissues that needs to lengthen is obviously the diaphragm as the rib cage comes down. So as I go to touch my toes, I can actually get almost to my knees without even moving my lower back, but that depends a lot on my rib cage mobility. So you're going to see in this series, the rib cage mobility is going to be very, very important. Now, if you haven't done so already, head over to www.thegotophysio.com/diaphragm. I'll put a whole report there for you with all the evidence, all the research, going into this in a lot more detail. So what we're going to do in the coming series is we're going to go through some key factors in the subjective assessment today. Then we're going to show you some simple assessments to take on board, and then also how to get all of these things moving so that you can build a rehab program that's built on a solid foundation of cement rather than quicksand, where the patient just has short-term results and the pain comes back again. Okay, so with that said, let's get straight into it. I'll see you on the other side. So welcome to the lumbar spine month, and in the lumbar spine month, when I was in new grad physio, I remember every lumbar spine patient that was coming in, I'd be sticking my elbow in their glutes, their QL muscles, which is probably their kidneys looking back at it, and you know, I might do a little bit of hands-on on their lower backs, and you know, I was getting okay results. But then, you know, I started to step back and again ask myself, why are all these tissues reacting or going into protective tension? And then I started to come across the importance of the diaphragm and the pelvic floor to back pain especially. And the pelvic floor and the diaphragm, they work together with respiration. Okay, so from my own point of view and how I look at the body is, okay, what's the most important thing to Pete's nervous system and his brain? And obviously that's to keep him alive and keep him safe, okay? So one of the most important functions or organs in Pete's body is, or systems even, is the respiratory system, okay? So the respiratory system is probably more of a priority than the musculoskeletal system to a point, because if Pete's respiratory system isn't functioning, okay, then, you know, he's dead, okay? Now, yeah, we could say, okay, well, we need that musculoskeletal system to keep us safe and to get away from danger, etc. Yeah, that's fine. But I think in terms of priority, you know, we need to appreciate that the respiratory system may be more important. So what I'm getting at here is when we look at the diaphragm has a dual role. So the diaphragm's got a role for the respiratory system, obviously, to keep us alive and keep things pumping, but it's also got an important stabilization role that's been shown on the research for the lumbar spine. So as it attaches, the psoas is also going to attach in and very, very close to the diaphragm, and they've been shown to have a very important function in terms of stabilizing that lumbar spine. Okay, so the diaphragm's got a dual role. It's got a role to stabilize the lumbar spine, and it's also got a role of respiration, okay? So how we can make that clinical is when that athlete or that patient comes into you in back pain, is we want to look for a few things. So we want to understand, is that athlete able to use the diaphragm efficiently for the thing that's most important to it, which is keeping alive and breathing, okay? So how we're going to spot this clinically is an athlete might come in and they might be talking to you, and even a private patient, and you'll see that they're a little bit short of breath. Okay, so as I'm talking now at the moment, I'm okay. I'm able to, do quite a few words, and I'm actually, pretty much talking all the time here. I took a small little breath there initially, and I'm keep talking to prove a point here, okay? And now I've breathed it in, okay? Or I've took a breath in. Whereas a lot of these athletes, they'll be talking, and then they're going to continue, and then they're going to breathe in again. So looking for when that patient or athlete takes a breath in and how many words they can get out is a nice clinical sign that I use, okay? So if you see an athlete and he's talking to you and he has to take a breath in again, and then he's taking a breath in again, that's probably an athlete whose diaphragm is struggling to lengthen, okay? Because when I'm talking and I'm exhaling, my diaphragm is lengthening, okay? When I'm inhaling, my diaphragm is shortening. So somebody who's struggling to talk for a long time or just talk at rest naturally, as I do that, that's an indication that that diaphragm probably isn't lengthening, okay? Now again, the diaphragm lengthening is going to be very important, because when that diaphragm lengthens, okay, as that diaphragm comes up, the rib cage is depressing. And as that rib cage comes down, as the diaphragm lengthens underneath it, the transabs are going to contract, the obliques are going to contract, the rectus abdominis are going to contract, your glutes are also going to contract, okay? You're going to have that posterior tilt of the pelvis, okay? So as that rib cage depresses, pelvis is going to almost roll with it, and everything's going to be in a much better length-tension relationship, okay? So to go back to my point, the ability to talk for a long time without taking a breath shows us that that person's probably not struggling with that diaphragm to lengthen, okay? If they're struggling, or after a few words they're constantly taking a breath in, then we would suspect that that diaphragm may need a bit of a helping hand in restoring the ability of it to lengthen, okay? And we've got a lot of ways that we can use to do that. So that's the first thing. The second thing is I'm looking at Pete and what's he doing at the moment, okay? So Pete has his lips closed, that's perfect. So Pete's nasal breathing, are you doing that deliberately?
No.
Good. So he's well taught now. So the other thing you can look at is when you're talking, you can ask, or sorry, not ask, but you can observe the patient while they're listening to you. So when I'm talking to Pete, I'm looking, and as Pete's not talking and he's listening to me, what's his mouth doing? So is Pete's mouth open, or is it closed? So if Pete's mouth's open, the chances are he's using a mouth breathing strategy, okay? Now again, I like to keep it very, very simple. If somebody is sat at my desk or in the physio room and they're talking to me, okay, or they're listening to me, sorry, then they're not using a lot of energy expenditure, their demand for oxygen isn't great. So they should be able to use the most efficient strategy possible, which is nasal breathing, okay? If that athlete's just ran, okay, and he's been out training and he comes into the physio room, maybe he's got to be mouth breathing for a little bit, that's okay. But in a scenario where he hasn't been exercising, he's sat down, we're going through his subjective, he should be able to breathe through his nose, okay? Because that's the most efficient strategy. There's a lot of good benefits of nasal breathing, which we're going to go into in a lot more detail in the mentorship. It's a little bit beyond the scope of here, but it's something that you can easily get if you want to go and search for it, okay? Now, why we want Pete to nasal breathe is we want to slow down that respiratory rate. I want to improve his respiratory depth. So a lot of athletes that are short of breath and are constantly taking a breath in, okay, the respiratory rate's going to be quite high, okay? The other thing as well is when the respiratory rate's quite high, the depth of breathing is going to be quite low. So they're not going to have an opportunity to have a good full diaphragm expansion. And the diaphragm, it's a funny one at the moment, and there's a lot of people kind of jumping on the bandwagon, but the one thing I would say as a new grad that you need to be aware of is that there's a lot more to the respiratory system than just 3 sets of 10 deep breaths, okay? If you ask an athlete to take 3 sets of 10 deep breaths, that may not cut it, okay? Because the respiratory system reacts in anticipation to perceived threats or stressors to your system, okay? So if you're about to go on stage and deliver a talk to 2,000 people on a subject, that you may not be very confident about, your respiratory rate is probably going to be quite fast, okay? You're nervous, so subconsciously that breathing rate increases, okay? Then you're probably going to use some kind of altered strategy. And it's the same with any other stressors in the body. So the respiratory system reacts subconsciously, okay? So using 3 sets of conscious breathing, of diaphragmatic breathing is okay and it's not wrong, but we just need to understand, and I just want you to make you aware that there's a lot more to the respiratory system than that, okay? So if you're doing, you're focusing on just 3 sets of 10 and you're not really getting the results that you want, then maybe we want to start to ask better questions. Okay, why is that respiratory system reacting like this in the first place? Now, the 3 sets of 10 diaphragmatic breathing, that may be useful when the athlete notices that their breathing rate has increased, okay? So that could stop further reactions, and that's a thing that I would find useful in that scenario, okay? If the athlete was getting a bit stressed, they noticed they were getting a bit short of breath, they were getting a bit anxious, they felt their back tighten maybe or something like that, or maybe they even are in pain at this present moment, then we can use those 3 sets of 10 diaphragmatic breaths just to get that person back in the present moment and to get them out of fight or flight and back into rest and digest. Okay, your parasympathetic nervous system. So the sympathetic nervous system is when you're in fight or flight. Usually that's associated when we have pain. And the parasympathetic nervous system is when we're in rest and digest, we're relaxing. Okay, so there's no adrenaline pumping anymore. There's no cortisol being pumped around the body. We're starting to relax, replenish and restore our energy reserves. Okay, so that's the big thing that I want you to look at with back pain. Okay, I'm sure this is probably a little bit different to what you're expecting with this back pain lecture, but when we go through the objective assessment, I'm going to show you the importance of getting that diaphragm to be able to lengthen, to get that rib cage to be able to depress, because the two of them things are going to have a big impact on the ability of your transabs, your obliques, your rectus abdominis, your glutes to function. Okay, so when I was a new grad, I was focused, I almost got pulled into that bandwagon of pulling the belly button in, squeezing the glutes, and then for me, for the first few years, everything was about the glutes, until I finally realized that actually, unless that pelvic floor and diaphragm can move, the length-tension relationship is going to be a little bit altered through those glutes anyway, okay? Because the axis of rotation, those tissues are going to have a big impact on the ability of that pelvis to posterior tilt, okay? So key points to sum it up. Person comes in, you're looking, are they able to talk naturally, or are they constantly breathing in, okay? So is their respiratory rate quite high? We're also looking at the mouth. Is that athlete able to nasal breathe at rest, or is he mouth breathing? And then the other thing that we want to check, obviously, if the person has a deviated septum or they've broken a nose in the past, then we might want to check that. So what I like to do is I like the athlete to, I'll just say to the athlete, okay, I just want you to close your mouth and just breathe through your nose, okay? And if that person can do 2 or 3 breaths, then we know that they can do it, okay? If the person's going blue in the face, then we may suspect they've got a compromised airway, and then in that case we obviously wouldn't recommend breathing through their nose. We might refer them if we think it's a significant issue, but that's something that's maybe a little bit beyond the scope of this current lesson, okay? So to recap, shortness of breath, a lot of breathing in while they're talking, and then when they're listening to you, are they nasal breathing or are they mouth breathing, okay? Those 2 things are going to give you an indication of whether we need to focus on diaphragmatic breathing and actually decreasing the sensitivity of the respiratory rate to slow it down. And if we slow that respiratory rate down, then we're going to be able to mobilize that diaphragm a little bit better, which is going to help the rib cage to move, which is going to help the pelvis to move, and then hopefully then it's going to desensitize some of the tissues that may be sensitized that's contributing to that low back pain. Okay, so I hope you found that useful today. I hope there's some things that maybe just triggered your brain a little bit. As always, if you want to learn more about this approach, head over to thegotofysio.com. I've got plenty of resources there to help you get the confidence and clarity to look at the body as a whole without getting overwhelmed and getting lasting results with your patients. Now, what we're going to do in the next lesson in this series is we're going to show you how to do this with an objective assessment, how to look at the body as a whole, how to find what's not doing its job so that we can get the low back just to worry about itself and not try to do the job of everything else. Right, that's it for this week. I'll see you on the next lesson.